Okay, everybody's ready? Good deal. Well, good afternoon, everyone. I'm Brian Hammond. I'm the chairman of the Lee County Board of County Commissioners, and this afternoon I'm joined by Commissioner Frank Mann from District 5. I'm also joined by Angela Smith, the administrator of the Florida Department of Health office here in Lee County, and Jennifer Roth from her office as well. I want to start by thanking Angela and her team for the amazing life-saving work and the long hours that you all have put in since COVID-19 first appeared in Lee County in March of this year. Today we're standing here shoulder to shoulder, well, 6 feet apart, but still shoulder to shoulder, as partners in this fight against COVID-19. If there is a silver lining to be found in this pandemic, it's that Lee County and our local health department now have a partnership that's stronger than it's ever been. Behind us is actually one of the newest tools that we have in our fight against COVID-19 and in our fight for better public health. This is one of the first of 3 mobile testing units that Lee County is going to provide to the local health department office. This unit was actually a former ambulance, and it can be used for COVID-19 testing throughout this pandemic, but it can also be used for flu testing, for flu vaccines, and for any other community public health response that's necessary. The vision is to bring the testing to the communities. You see, some can't make it to the drive-up sites, and some don't have the means to get to doctors' offices. So in those cases, we can bring the resources to those communities, and that's what we've done here with this walk-up testing site this morning. For the month of September, we have 9 community testing events just like this one every Tuesday and Thursday throughout the month of September. Details on where those testing sites will be are on our website. It's leegov.com. That's leegov.com. And you can find out where those testing sites are. On behalf of all the county commissioners, I want to say that we're extremely proud of this partnership with the health department and of the work that all of our teams have done, whether it's our public safety team with Chief Ben Abes or Angela's team over there at the health department. I want to say that we're ready. We're preparing for the battle this coming fall, whether it's flu season or COVID season. And to say a few more words about our efforts, I'd like to introduce Angela Smith, the administrator of the Lee County Health Department.
Thank you, Commissioner Hammond. I want to start by expressing my sincere gratitude to you, Commissioner Hammond, the Board of County Commissioners, County Manager Desjardins, Christine Brady, and Lee County Public Safety in particular. And that's not just for the provision of resources for this mobile unit that you see here. As Commissioner Hammond mentioned, this has been a steadfast partnership since the onset of this pandemic. And we truly appreciate everything that's been done to support us and all that you continue to do to support us. Today, as you can see, we're hosting COVID-19 testing with the mobile unit. Services will be expanded to include the provision of immunization services. One of those immunizations will be influenza vaccine. Influenza vaccination is going to be particularly important during COVID. And here to talk a little bit about COVID and influenza vaccine and the importance of getting your flu shot is Communicable Disease Director Jennifer Roth.
Thank you so much. Thank you to my health department administrator, Angela, for all of our support here. And I really just wanted to express, why are we pushing a flu shot when we're still worried about COVID? And, the truth is flu season is upon us. Officially, it starts in it starts in October here in Florida, and it goes all the way through May. And it has been proven time and again that the annual flu vaccination does actually help prevent negative outcomes. Not only does it help prevent you getting the flu, if you happen to be exposed to the flu, it can also reduce the severity of the illness should you happen to get a strain of the flu not covered by the flu shot. Every year, the flu shot contains 3 or 4 strains of flu that we believe will be circulating within the community. And this year, we are hopeful that we will have a very strong showing for people getting their flu shots. Flu can cause serious illness, it can cause hospitalizations, and it can even cause death. And in this time of when we're working with COVID so closely, we have to remember that the flu can also have such serious negative outcomes. Last year, 500,000 Americans were hospitalized with influenza. So we absolutely need to decrease the prevalence of influenza in order to preserve our healthcare resources. So that way, as COVID continues, we can help to battle the pandemic on that front and not have to be as concerned about flu as we typically are this time of year.
Well, thank you very much, Jennifer. So normally at events like this, you're used to seeing commissioners cut a ribbon or maybe turn some dirt. Today they've asked if I would get a flu shot. And so I said, of course. So we will have an opportunity for you all to video me getting my flu shot this year. Let me just briefly tell you why I get a flu shot. I'm going to start by telling you about the 2 years I did not get my flu shot and what happened to me. So as you know, I've got a family, and my wife and I, we have 2 children. 3 years ago, we decided, we just forgot, slipped our mind, didn't get our flu shots. And what happened was all of us came down with the flu the week of Christmas. And we missed Christmas Eve and Christmas Day. We were all too sick to get up and do presents. My family would drop food off at the door and then leave. And it was crazy to be stuck in our house and away from everybody and sick. So that happened to us 2 years in a row. 2 years in a row we got the flu during the week of Christmas. And so after that, we all made a pact that we are getting our flu shots heading into flu season so that never happens and we never miss a Christmas again. But on top of that, obviously, I want to make sure that the flu would not be taking up valuable resources in the health system right now that we need to respond to COVID. And I would certainly hate to be the person who spreads the flu to somebody who wouldn't do well with it. So that's why I'm proud to go ahead and get my flu shot today and give you all an opportunity to see that. And with that, we'll go ahead and take any questions that you have.
You talk about the influx of this will be the flu, and then we're already going through COVID. Are you guys prepared, or how are you preparing if there is an influx in COVID-19 cases, and then also the flu? What are you guys doing to prepare?
Yeah, I'll let Angela and Jennifer talk about that as well. But from the county side, we're absolutely far more prepared now than we were in March of this year. You know, in March of this year, none of us knew what we were dealing with. It was a brand new disease. No one had ever heard of it. We didn't know how to respond to it. Now that we've seen it in our community for several months, we understand how to test for it. We understand how to isolate away from it. We understand how to respond to it. And the proof is behind us. We've got now more tools and a better partnership in order to respond. It's not new to us anymore. Angela?
So the push for influenza vaccine is part of that preparation because, as you can imagine, we don't know a lot about what co-infection with influenza and COVID look like. The research is still looking at that. However, anecdotally, we can assume that would not be an optimal situation to get into. So by reducing the flu transmission in the community by vaccinating, we're hopeful that we can tamp the flu down enough that we're still only focusing with minimal flu cases if we're still dealing with COVID.
Yes.
Can you tell me how exactly you plan to do vehicles?
Oh, yeah.
Absolutely. The sky's the limit. So this is a model that's used across the country, to bring much needed services into communities where transportation is an issue, or perhaps individuals just don't want to leave their communities. So it's, immunizations, it can be STD, HIV screenings, family planning, you name it. The sky really is the limit when it comes to what they can be utilized for. We're just incrementally increasing the types of services so we don't bite off more than we can chew. Does that answer your question?
I mean, it does, because I like the idea that it's more part of like the county plan to improve access to health in general. But in cases of COVID or shots, are people going to be more decided? Is it bringing, supplies out to sites? What's that?
Sure. So you're asking more the logistical. Okay, so they're air-conditioned units. There's refrigeration and freezer on them, which is huge. Right now, you'll see at the testing pavilions behind me, there are coolers. We have to keep the specimen collection kits at temp. Then once we collect the specimen, those have to be kept at temp. Our poor staff, they're covered in plastic PPE. So These units give them the ability to store all of those things more safely in an air-conditioned area, as well as have rehab locations for staff to come get out of the heat and so on and so forth. So it'll really depend where we're at from a communicable disease standpoint. You know, if COVID is prolific, no, we're not going to bring people on board into a confined space. It'll look like this. It'll just be more support for staff for vaccine storage and the specimen storage.
So is the plan to keep it here, or is it to move around?
Oh no, we're going to move it all over, and we're going to try to make this fun. We're going to, Tammy, our PIO, we're going to be working to do some things with social media, so kind of track the mobile units.
I wonder if you have any kind of indication about this year's flu strain, how much information you have, severity. I haven't heard a lot of information about it.
We're always a year behind when it comes to the flu, and I'll let you talk a little bit about that.
Yeah, that's an excellent question, and it is true. The flu, typically, the new strains emerge out of Asia, and then they work their way westward, and then by the time they get here, half of the world's already experienced their flu season. Early reports so far haven't really indicated any kind of severity of flu from Australia or other countries that we typically look at when we're concerned about what strains coming our way. Of course, by the time it gets here, it could also mutate again, and we have seen that happen. So right now, we're just sitting and waiting to see what strains emerge, but so far we haven't seen any severe strains coming out of other countries. And then our flu shot every year, you know, it's 4 strains of flu, and then by January is typically peak season, can range between January to March here in Florida. But by January, we typically know what we're working with, what we're dealing with, and what kind of vaccine we need to go forward with, and how effective the vaccine is. The early estimates come out in January. So at this point, we'll just have to kind of sit and wait. And like I said, we're just trying to push the flu vaccine now, so that way we don't run into that situation where we have severe flu and COVID. In addition to saving hospital resources, we also want to make sure that we can appropriately diagnose people with COVID so that we can isolate them. As you know, the symptoms of flu and COVID are very similar. And if we run into a situation where people are having both within their community, it will be that much more difficult for the healthcare community to do extra testing for flu and COVID and diagnose people and appropriately isolate them for COVID if we also have to then rule out the flu at the same time.
Well, thank you very much, folks. If you give us just a moment, we'll get set up to do the flu shot, and I think we're going to try and do it right over here in the shade still for everybody. Thank you again.